yesterday that the CEO of United was shot and killed, and you also may have seen that Anthem Blue Cross Blue Shield. Um, I'm laughing, but it's like not funny, but it is funny. They're only going to pay for half of your anesthesia during surgery. You know, you get to pick which half you want, but the other half of your surgery, you have to be awake for it. Wow. Okay, so I'm not ever gonna sit here and be like, I'm glad somebody's dead. So if that's what you're looking for, this is the wrong video. There are plenty of other people out there on the internet that are saying that right now. You go. But what I will say is, like, people are not happy with their health insurance. But I will tell you what is not the solution, which it is when you say it, and if it happened that way, sure, which is universal health care. I've worked in many countries' healthcare systems that have universal health care, and what ends up happening is anybody that has any money anyway gets their own private health insurance, and so you're essentially back to this system anyhow, because free, it's like if you get arrested, do you want the free guy that's going to defend you, the public defender? Some public defenders are okay, but you're going to want to hire your own law firm. If you have the money to get something better, you're probably going to pay for it. So it would be essentially like the DMV running your healthcare system, which if you like the service at the DMV, then it's for you. I live and work in the DC metropolitan area, and I'm somewhat familiar with how the government works around here. I don't think that anybody would argue with it being very slow. Very slow. So if you want very slow healthcare, I guess. But what ends up happening is people are like, well, I don't want this free healthcare. I'll just buy my own. And then you again have that discrepancy. And all the poor people are stuck with like that crappy free stuff, and then anybody that has money is getting their own private insurance. So I'm not sure that is the solution. What I think is the solution is what I am doing in my clinic. I charge a price that pays for all my overhead, which I think people think that whatever my office charges patients goes right into my pocket, and it's like, no. Most of that goes to the insane amount of overhead that comes along with owning a business. I think that most businesses' profits margins are in like the single digit percent, like 1% more than what they charge. So you need a non-corrupt individual like myself charging fair prices for their services. But oh, and then I have another video that explains like comparable services to what I charge. Like a plumber costs way more, and a divorce lawyer costs like twice as much. And you know, so it's all relative here. But there are even still people that can't afford to pay that much. And so how do you make it fair to them? Well, we have a sliding scale application, and they submit, you know, how much money they make, and based on that, we come up with a fair price. And I mean, I think that is the way to do it. That makes sense. But you know, I'm not going to change an entire system. And you also have to realize that if you take a system from another country and then just plop it down in the United States, it's not going to work. There's a lot of logistics that are going to need to go into that. And so it's just like, okay, the healthcare system's broken and people are really fed up with it. There's no easy way to fix it, but there's definitely like a way to somehow decrease the insanely high level of corruption that is occurring. It's like, you know, with everything, you're gonna have corrupt people, but I feel like in health insurance, it's like a disproportionately large amount of corruption, and so maybe just bring some of that corruption down a little. Like pay for the entire surgeries, anesthesia, like that would be nice, because where is the money going? Do people really need to make hundreds of billions of dollars in salary? And if you actually look through now, Maya Kowalski trial against a Johns Hopkins affiliated hospital in Florida, the whole end of the trial goes through their financial records, and these giant companies have these ways of like hiding money really well. It's like it's a whole thing, man. Like, it's a whole thing. And so the amount of corruption could definitely come down, but there's no way to make it just like real easy and fair to everybody. Like, there probably isn't a process out there that's like everybody loves and it's fair to everybody, but it could definitely be better. But if your health insurance is run by the government, it's gonna be like going to the DMV to get your physical exam. Last time I was at the DMV, I came as soon as they opened, but still I waited like 3.5, 4 hours to get up to like a customer service person. Like, oh, I mean, it's better than nothing, I suppose. But is that where we want to set the bar? We want to be satisfied with better than nothing, or do we want to make it like a reasonable quality service for everybody equally? Which is what I do at my clinic. Like, if somebody doesn't have the funds, then we provide the funds, and then everybody gets the same quality of service. I don't know. I can't convince the entire world to conform to what I think is a reasonable way to provide healthcare. And all the CEOs wouldn't have the $100 billion salary. They wouldn't want that. And gee, it's just people are really fed up, and there's no like one really good solution. But I mean, I think the best solution is just what I do in my practice. It's reasonable prices. I got the whole video about stuff that costs more than what I charge. But again, not everybody can afford it, and then we provide help to those individuals, and then everybody wins.